My name is Nina Leadus Cannon, and I will be presenting today along with Francesca Jerez, who current successful applicant to medical school and has done quite a lot of medical school interviews. So she will be sharing her advice and perspectives on how to prepare for the medical school interview. We'll also be discussing the dental school interview and answering questions about that as well. Okay. Oops, let me go back. Okay. Francesca, if you could also keep an eye on the chat because it's hard for me to present and also respond to questions. Or if you feel that the question is better just asked, you can always interrupt me and I will stop and answer it.
Sure, no problem.
So again, we'll begin in a couple of minutes. I'm still letting students into the Zoom session and make sure you're in a place where you can focus and pay attention to what we're going to be discussing today. All right, I think I'm going to get started. If students decide that they're going to come in a little bit later, I will let them in as they make their way over. All right, just to make sure you are in the correct place, this seminar is a PAP 1003 application planning seminar on the traditional medical and dental school interview. Okay, there is a reflection statement that you will complete at the after attending the full seminar today, and I can post the link to that. You should have received it. If you registered for the seminar through the regular protocols, but if not, I can share that form with you in the chat just to make sure you have it and you get credit for attending today. All right, let's start. Okay, so congratulations. You have an interview. This means, medical dental schools find you compelling enough to review your application materials and see if you are a good fit for their medical or dental school program. Today, we are covering the traditional medical dental school interview. We have a separate seminar tomorrow on the MMI format interview. For both today and tomorrow, I have the great pleasure of being joined by Francesca Jerez, who is a current successful applicant to medical school. She has had many, many opportunities to interview, and she is going to be sharing her perspectives and advice as we go through the slides here today. She also will be happy to answer any of your individual questions, either during the seminar if they relate to a specific slide, or at the end of the seminar. And Francesca, I will ask too, you feel free to interrupt me at any time. And just, if you have something to add or you want to give some of your own perspectives or advice, please do so. Okay. All right. So what is being assessed? And the point of the interview, the whole point of the interview is really to determine, is this person one of us? And that doesn't mean, based on your background or, where you come from or your religion, or anything relating to that. It just means who you are as a core person. They're making a determination to see if this person really looks to me like someone who could be a doctor of medicine or dentistry. Are they the right fit for our medical or dental school program? Have they had enough experiences and exhibit the maturity required for that particular program? So, there are hard skills and soft skills that medical and dental schools are looking for. In terms of hard skills, we know what they are and how they're evidenced. They're going to be in your grades, which are going to be shown in your transcript. They're going to be in your test scores, which will be shown in the MCAT and the DAT score. They will be shown by your experiences that you've had as you describe them in your activity descriptions and your overall application. But they're also looking at soft skills, right? So they're looking to see if you display empathy, compassion, critical thinking, altruism, integrity, intellectual curiosity, adaptability, and resilience. So there is a lot that's being assessed in the interview. Now, when you receive an invitation to interview at a medical or dental school, you want to not just let it sit there on your laptop and just kind of look at it and go back and look at it and kind of figure out when you might be able to fit it into your already busy calendar. You want to respond immediately. Am I right, Francesca?
Yes, you want to take the first, because they, especially if it's through an email, they know when you accept, they know what date you choose. And so if you sit on it, it just doesn't show enthusiasm for the school.
Right, right. And that also means that you have to be on top of your emails. You have to make sure that you are checking all of your, your folders, because you don't want an invitation for an interview to somehow land in your junk or spam and not respond. That would be very, very unfortunate.
I
So,
just have something to add here as well.
sure.
When I first started applying, I made a separate Gmail for medical school in like applications, and I wouldn't use your school email because I know a lot of my friends this past cycle had problems with it, especially if you're graduating, transferring it over. So I would do that. And then also, once you get the secondary applications, you can mark that address as important. And so it would never go to your spam. So you kind of preemptively prevent that from happening.
All right. That's great advice. Great. You definitely want to choose the first available date. So even if they give you, dates way out in July or August, or even September, you want to make sure that you choose that first available date, because many times the earlier you interview, the earlier you also have your applications considered in full by the committee, and the earlier you have the opportunity to learn about your admissions decision. If you're confirming your interview date, to an actual person that you call, you want to obviously express your gratitude for the opportunity and excitement to learn more about the program. If you're, responding through email, you can just write that in the email. But I think the point that I'm trying to make here is that your interview, in quotations, comprises every interaction you have with a given school. Every email, every phone call or conversation before, during, and after your actual interview date. So you have to be your best self at all times. And this includes the information sessions that are often held along with the interview days. And I don't know if you want to add to that, Francesca.
I just remember I was interviewing at a school, and so we were all in a Zoom, and it was an interview. It was in the interview day, but we were all in an information session. And one of the deans of admission says, like, you are being watched right now. If you don't look excited to be here, even in the information session, we notice. And so, I mean, even though one school said that, it goes to show every single interaction with the admissions team reflects on you, and they remember who you are. So you don't think, oh, I'm one of 20, they're not looking at me. They definitely are.
So there are several different types of traditional medical or dental school interviews. There's the open file, which means that interviewers have access to your application and questions can be asked about anything in your application. There is the closed file, where interviewers do not have access to any application information, or they may just have limited information related to your personal statement and activities. But understand the traditional interviews are highly subjective, as every interviewer has a different style of questioning. Some schools will mandate a standard list of questions to be asked during each interview, while others encourage a more free-flowing conversation around certain themes. And Francesca, did you find that, depending on the style of your interviewer, I mean, I'm sure you experienced many different kinds of interview styles. I mean, maybe you could just talk a little bit about your experience in that regard.
I think that it's very highly subjective. I had interviewers who had a standard list of questions and they just were going one after the other. And it just felt very not natural. And you feel like it's not, and you're told like it should be a natural conversation and it isn't, but the outcome is still fine. But then there's others that it's really just a conversation and it flows. And then there's others where they're clearly trying to see if you're a fit for their specific mission of the school. So I think that when prepping for an interview, when prepping for the traditional interview, it's really school specific, which you could learn more about on Student Doctor Network and Googling it, but it's very school specific and you have to be kind of open to what specific to the interview, because even within a school, it can change, especially like I've had schools where you interview with more than one person and just from person to person, it's very different. And so you have to be flexible, and that really comes from just practicing.
So you really are going to need to convey what your experience has been in medicine and dentistry, I think it's important to convey that you have the discipline and commitment to make it through the rigorous program, and that you've thought about and to some degree understand the current and future state of medicine and dentistry. Are you informed about the medical or dental school you're interviewing with? Do you reflect their mission and values? And these are the things that you're really going to have to think about as you prepare for interview experiences at different schools. Let me just get my, okay. So you really just have to ask yourself, what am I getting myself into? I mean, I think that's what they really want to understand. Like, have you done your homework? Do you know why you're doing what you're doing? Meaning why you're pursuing a profession in medicine, why you're pursuing a profession in dentistry. Ask yourself, how can I convince my interviewers that I've seen both the good and bad in medicine or dentistry, and I still want to be a doctor or a dentist? So consider your experiences that you have that have shown you a diverse, realistic, and well-rounded view of medicine or dentistry. Think about your work experiences in the field, both paid and volunteer. Think about experiences you've had with high-pressure situations, examples of when you had to be adaptable and when you had to deal with change, when you had to persevere. Stories from your life about your ability and willingness to sacrifice to attain your professional goals, because you want to be able to weave in these experiences and stories into the questions that are going to be asked.
I will just also add to that that you not only need to explain that, but also why not any other career in healthcare? Why a doctor? Why not a nurse? Why not a physician assistant? So you not only have to say you have experiences with being a with what entails being a physician, but why that and not something else, which is another layer to it.
Yeah, definitely. And in doing that, you have to distinguish what abilities you're going to be having as a physician or a dentist that you would not have, you know, as a dental hygienist or as a physician assistant or some other career in healthcare. I also think they're going to really test to see whether you have the discipline to make it through. I mean, for every student I've spoken to who is now, you know, entered and attending medical or dental school, it is a grind, okay? So one of the things they're looking for in the interview is, are you going to be able to handle the rigor of this kind of program? So think about what you're doing now that show your ability to balance work and your studies. Think about your experiences with the unpleasant side of medicine or dentistry, right? And show that despite these things, this is still the only profession for you, okay? And, you know, be able to really talk about the experiences you've had that have made this desire stronger despite the challenges presented. Talk about sacrifices you've made to work or volunteer in a medical or dental setting. You know, did you choose opportunities that may have been inconvenient for you, but were important for you to have exposure to certain areas of medicine or dentistry or certain patient populations, right? But you really want to show that you can go the distance and be successful both during medical or dental school and after, throughout your profession. So preparation is key, okay? You have to do the work. Memorize your entire application. Remember, you're applying in June. You're going to be having interviews. Do you remember when your first interview was, Francesca? August
My
sometime?
It was August, but I mean, I had an interview last month, so the range is very,
Yeah, I mean, it could be August through February for sure. And many interview through March. So this is, there is a span of time. You have to go back and remember and reread what you put in your application, reread your personal statement, know your transcript, know your experiences, know your secondary essays for that program. And remember what your goals are during your gap year. If you're still a full-time student, you're going to be talking about what you're doing both in and out of the classroom. If you graduated, you will have to be talking about how you're spending your days and what was your reason for choosing these opportunities. Are you working in a research lab? Are you a medical scribe or EMT? Are you taking part in advocacy work or teaching? Are you completing a master's degree? Are you working in a dental office? And, are you pursuing other dental experiences? Francesca, did you talk a lot about your gap year position?
yes. And specific to me, which is an often thing, I work in a research lab. And so I also think it's very important to be able to talk about what you do to someone that may not be, this is specific to science, but may not be in science. Because when I talked about my gap year, it was always talk to me as if I'm not in science, if I'm not in the medical field, and how would you explain it to me? So really thoroughly know what you do and why you do it and what your role is and your responsibilities, and also just to hit like back on the memorize your entire application. I will never forget the first question I had in a traditional interview was, I just wrote growth year instead of gap year in my secondary essay. And her first question was, why did you write that? And I had attended this PPAP, memorized my application. So I had an answer, but like that goes to show how they will just pick out certain things. And another time she picked out a certain class I took in a winter semester, excuse me. So really, like, that's not to underestimate it. Really know your application.
Yeah, that's very good advice. And also know the qualities of a good doctor, right? Because they're looking for those qualities in you as you present yourself in the interview. They're assessing, are you a person who can exhibit empathy, compassion? Are you humble? Do you have some degree of medical or dental experience from your current experiences? Are you someone who can collaborate with others? Are you a leader? Are you a health advocate or educator? What's your experience with activities that show your ability to advocate or educate others? Are you someone who exhibits professionalism? And that's something they can see in an interview as well, just by the way you speak, the way you present yourself, the way you prepare, the way you respond. All of those things are going to be assessing. Now, I would say, and Francesca, were all your interviews virtual or did you have any in person?
They were all virtual.
Okay. So this is the new way of holding interviews. And I think this is the way it's going to stay. Even though we are officially 5 years out from the pandemic, I think just logistically, it's a lot easier for applicants to set up and prepare for a virtual interview. It's also cost effective, and it's also something that has been embraced by both medical and dental schools. There are some dental school interviews that are held in person, but I think Toro and Buffalo may have in-person interviews, and of course, there's always the opportunity to go to the school and personally visit, especially for dental school. But that initial interaction for the interview is going to be virtual, which adds on a whole additional layer to your preparation, okay? Because you're not showing up in a suit, presenting yourself in person and engaging in person. But you have to give that sort of same appearance and you have to exude that same energy that you would in person. So it is really important that you invest time in figuring out an appropriate background and location with reliable internet. The last thing you want to do is to freeze mid-sentence during your medical school interview. You want to confirm that you updated all your programs, that if it's a Zoom interview, you want to make sure all of your Zoom settings are up to date and everything has been, properly updated. You want to make sure your devices are working and are fully charged. You have, a fully working webcam and a fully working microphone. I don't recommend using a large headset to take your interviews. I think it's distracting to the interviewer. They're not really focused on you and what you're saying. They're just too busy staring at these, huge headphones you're wearing. If you need to wear earbuds, do so. But even with earbuds, I have had a lot of meetings with students, and if one earbud is not properly charged or there's some situation where it's not properly connecting to your laptop, I have also had problems hearing the student or their voice is somewhat it's not doesn't come in clearly. So if you can find a quiet space free of distractions where you can take your interviews, that's going to be a huge advantage for you. We're also going to talk about interview attire later in the presentation. I recommend, though, having a glass or bottle of water next to you so you don't, these interviews are hours long. And Francesca, you can chime in on that. But you want to make sure you're in a place where you're comfortable and if you get thirsty or your nose starts to run, you don't have to get up and get a tissue or a glass of water. I also recommend taking the interview in a stable chair, okay? Stationary, not a swivel chair. Why? Because even though you may have a swivel chair by your desk, there is this natural inclination to just move around. And it can be very distracting to the interviewer. Francesca, maybe you can just mention a little bit about how long your interviews were.
They ranged from, I think the shortest was 30 minutes, but they're mostly an hour to an hour and a half.
Right,
The,
but aren't you there for longer because there are other
oh, yeah, the
parts of the
interview day.
interview day?
Yeah, they're days. They're a full day. I think yeah, they're a day long. Mostly from 9 to 2. I would say like that's the average, 10 to 2, 10 to 3. I would just say like in addition to this slide, you want to mimic a natural in-person conversation as much as you possibly can. So that's why I think a quiet space, no earbuds is very important. It's just everything on the slide is super important because it just goes to make a more natural conversation. And that's what you want because it'll make all of those qualities of a physician come across a lot better.
Did you have a chance to get up and stretch or like after, or were you really sitting in your chair from like 10 to 3?
There were a few breaks. They're not common. If there are breaks, they're short. They're maybe 10 minutes. They're not long breaks. But I mean, they say like you can go to the bathroom if you need to go to the bathroom, but you're really sitting there for a long period of time. I also always brought like a banana or something because I didn't want to get up because I didn't want to miss anything. So you could also do that. Also, having a water bottle when you're in conversation, it's like a nice break if you need a minute to just regather your thoughts. I always found it calming, but yeah, you're there for a long period of time, but it's like taking the MCAT, so
Well, so would you turn off your screen when you were eating your banana or you just went for
yeah.
it?
I would turn off my screen. Well, I mostly did my interviews at my job as well. That would make more sense why I didn't want to get up. And yeah, I would turn off my screen. I would turn off my screen if I had to go to the bathroom. But I mainly tried to limit that as much as possible because you just never know who's looking at you, and you just want to be there and you want to be not smiling, but just look engaged as much as possible. You don't want someone to look over and you're not there. So I tried to limit it. I don't know if it made a difference, but I tried to limit it.
Okay. All right, let's talk a little bit about what to wear, the interview suit. And a suit is expected for all applicants. This is a professional, traditional medical school interview or dental school interview. You have to step up and get a suit. And that's for women too. I mean, you should be, women should be wearing a nice pantsuit or just, a nice blazer and skirt. But it's, a suit jacket is definitely something that you will have to wear. And for men, ties are the accepted rule. For suits, the most common colors are navy blue, black, or gray. The shirt should, be not, a very light white, cream, or light blue, simple neckline or collar. Conservative tie for men. If I would just try to wear simple jewelry for your interview. No bright colors, no low necklines. In terms of your hair, if you cover your hair, choose a neutral color for your head covering. If you do not cover your hair, you want to make sure that your hair is out of your face and you choose a simple style. Okay, it's just you want the focus to be on you and what you're saying and not to be on your hair or your jewelry or anything else that could cause a distraction. For guys, if you wear a beard, just make sure that it's groomed. If you don't wear a beard, you really need to be clean shaven. Okay, you cannot, go to an interview with sort of a unshaven look. Okay, let me just let this person in. And if you plan to get a haircut, and or style your hair, just plan it around your interviews. And I think it's important to just make sure that you really look professional and put together for the interview. Make an effort. In terms of nails, I know a lot of women who, have fancy nail art. For the interview, I strongly suggest that you wear, clear or neutral polish and you wear shorter nails. They don't have to be short, but they just can't be, as long and decorated as you might typically wear them. If you wear makeup, it really should be natural looking. This is also a time to really start becoming aware and learning how to control nervous habits. In fact, I just had a meeting with a student last week, and she, throughout the whole meeting, was twirling her hair. And I said to her, you're going to have to control that in the interview, whatever you need to do. There are, individuals who just have a bad habit of playing with their beard when they speak, or touching their nose, or cracking their knuckles, and just become aware of these behaviors and be mindful of these nervous habits and really make an effort to practice lessening them. Also, even if you're someone who talks a lot with your hands, in a virtual interview, that's going to be very distracting. So you may just want to practice keeping your hands on your lap or keeping your hands sitting on your hands. But you have to become aware of these things. Also, become aware of where you look when you speak. I know individuals, when I gave them mock interviews, they would, when they were delivering the answer, they would be looking down and they wouldn't look up until they were completely done delivering the response. That's not going to work in a virtual interview. You have to engage with the interviewer, which means you have to deliver your response to them as if you're looking to them and speaking to them. So if it's hard for you to maintain eye contact, you want to start working on improving those skills. And you want to become aware of your overall communication style. There are certain words that students tend to say frequently. Maybe they use amazing a lot in their speech, or incredibly, or everything is like. I did like a research project, or I did like a community service project. And become aware of filler words that you use. And again, you're going to have to be mindful of this and start controlling your speech and working to not say those words. Do you speak too quickly, or do you fail to articulate or enunciate certain words? Become aware of these things. So you definitely want to, as much as possible, and of course no one is perfect, but try to lessen your use of overused phrases, like, so, honestly, literally, stuff. I know a lot of students who end their sentences by saying and stuff like that. Please don't do that in an interview. Everything is or thing. Become aware of these uses of language and try to limit them. Of course, never speak ill of others, work on being positive, taking a positive approach all the time, trying to end each answer on a positive note if you can, with a positive evaluation or hope. And you never want to speak ill of yourself. I mean, this is your time. You don't want to focus on negative behaviors or thoughts you exhibited. Focus on the positive ones that you have enabled you to get to where you are today.
I just want to add to that point.
Sure.
I think when you talk about, a lot of times they'll ask you about a difficult time or something of that nature. And when you reflect on yourself going through that time, just make sure, even if it was, you don't want to focus on the negative behaviors or thoughts that you exhibited during that time, because if you do, it signals to them that if you were faced with with challenges in medical school, you would exhibit them again, and that's not what you want to get across. So there's a way to talk about going through a difficult time and overcoming it without talking negatively about yourself, which is what I meant by writing that.
Yeah, excellent. And of course, try to back up your statements with examples from your own life to support what you're talking about. And I think by including stories from your experiences, this is a great way to respond when you're faced with any question.
I want to second that. That's so, so, so important. You do not want to answer a question without the same way you wouldn't answer a secondary application question without your own experiences. You never want to do that in an interview because it just gives an empty answer.
Yeah. Um, Also, you never want to come across as if you've memorized or your responses, or you're reading from a script. That is also going to come right through in an interview. I've done mock interviews with students where it looks like one eye is staring over to the right as if they have little pre-printed notes or cards that they're reading from their scripted responses. Okay, and this is going to come through immediately. So just memorize a couple important points or experiences that you would like to discuss or reflect upon with what you believe will be your commonly asked questions and practice your answers using these points. Even though your response is going to be slightly different every time you answer a given question, that is fine. You never want to come across as if you're reading from a script or as if you've memorized your response. Further, if you do memorize these responses, you might be thrown off more easily if you forget one point, or if the question has a slightly different nuance, and if and your memorized response doesn't specifically work with the question they're asking. So it really is best to focus on the wording of the question, what the interviewer really wants to hear about, and then tailor your response to that. Now, I'm sure Francesca, she mentioned every interviewer is different, and I'm sure she can talk a little bit more about how she was able to tune into that, but you need to pay attention to what I call the tone and the tempo of the conversation, and expand or contract the length of your answers as needed. So you need to adjust as you go based on the responses you receive. I've done lots of mocks with students who have, their set answer prepared, and they need to get all of that out, even if the interviewer seems to want to jump ahead to another question. That's not going to leave a very good impression on the interviewer. You need to be able to tailor your response to the kind of conversation that interviewer is trying to follow in that interviewer. And so it's really important that by the time you take the interview, you have to be at a point where you're comfortable speaking about all aspects of yourself, as well as everything included in your application. And that means every research project or extracurricular you participated in, even if it was several years ago. Okay, so anything in those materials is going to be a fair game to be asked about. But again, Francesca, if you could just expand a little bit about how you were able to pick up on the tone and tempo of the interview with each different interviewer.
So some interviewers will start off just a regular conversation. How are you doing? Just tell me about yourself. But some interviewers will just say, I have a list of questions I need to ask you, and I would like to get started if that's okay with you. And you can just tell the difference in the approach to the interview. And so if it's the latter, if they're just trying to go through the list, then you also kind of have to treat it that way, not as a conversation, but going through a list, but still giving your full and good answers. But it will just be less conversational. And that's okay. You just kind of have to adapt to it and still remain positive and still remain thorough, but also not try tangents. But if someone wants to have more conversations, you can kind of go on tangents. For example, a common question is, what do you do in your free time? And in my first interview was with a local school, and I talked about a local movie theater I go to. And since it's a local school close to that movie theater, I asked them, have you ever been to that movie theater? And so I wouldn't ask that question and continue that side tangent conversation if they weren't willing to have a more broadened conversation than just the questions being asked. And I remember when I read this slide a year ago, and I said to myself, how am I supposed to do this? But it really does come naturally to you with practice, and you all will be able to do it. You'll be able to sense it.
Good advice. All right, this is always one of the most difficult questions for applicants to ask and to answer in an interview, but it's also one of the most important because it really sets the tone for the whole interview. And what am I talking about? I'm talking about the tell me about yourself prompt, right? And this is really your chance to demonstrate who you are as a person. So I think many times applicants see this question and they immediately think, oh, well, I just need to recite what I've done. I need to kind of go through my resume. And that's really not the way to approach this question. What's really being asked here is not something that can be seen in your application. You have to think about the values that are important to you, what drives and what motivates you. Why is it that you want to be a doctor or a dentist? Not necessarily that you have to answer that question, like why medicine or why dentistry, in the tell me about yourself, but you do have to remember that you're interviewing at a medical school or at a dental school. So if all you talk about is your interest in music or art or dance or photography, or you know, other things that you do outside of your interest in medicine or dentistry, that's also not a way to really answer that tell me about yourself question, because at the end of the day, if you only talk about your experience as growing up on the ice as a competitive ice skater, then it kind of begs the question, like, well, okay, why are you here? Why is it that you're not just interviewing for a job to be a ice skating coach or run an ice skating academy, right? You still have to kind of talk about yourself in a way that shows that you sort of have pursued experiences, or you have values or lived experiences that have driven you to go down this path of medicine or dentistry. How do other people see you? And how do you see yourself? I mean, these are things you want to reflect upon when you think about this conversation about you and what you want other people to know about you. Think about what's unique about you, what distinguishes you, right? That's also what you want to communicate. And you also, as I think, Francesca, you carefully pointed out, and you can expand on this, you can alter your tell me about yourself response also to weave in the mission and values of the school you were interviewing at, while keeping the basic foundation of your response the same. And maybe you want to just expand a little bit on this.
Yeah, so I added this because I quickly realized after my first or second interview that they're about this mission and values, how important it is and how it's really probed in the interview. And so when you're writing, also I fully agree with everything said about the tell me about yourself question. I think it is that single-handedly the most important question that you will be asked, because it indicates so many things, but the main thing, how you articulate yourself and your values. And so I wouldn't go lightly on this question. I had so many versions of my tell me about yourself. So that's base versions, backbone versions. And so any with the school, I would always end it, because the way I would do it was like a roadmap of who I am, where I came from, and how did I get here, basically, in such broad terms. I can give anyone my tell me about yourself response if they want, but that's basically it. And so it kind of then leads into, okay, so why did I apply to this school? Well, oh, I applied to Georgetown because of this, because of my interest in philosophy and bioethics, and but it said a lot better. But so that's what I mean. You can have the whole backbone the same, but then kind of end off with, and because of this, in my tell me about yourself question is why I'm here today and why I'm excited to be interviewing with you. And it's so strong to end that way. And I think that you should do it for every one of your schools, because it makes it unique, because they know that this is a common question asked, but it makes it unique. It makes you seem excited to be with the school that you're interviewing at, that you should be in that interview. So I wouldn't take this lightly, and I would also think about altering it every time you interview.
Excellent advice. Okay, a little bit more. Think about the qualities, traits, and passions that have led you to pursue a career in medicine. Think about your life experiences that have made you into the person you are today. This is what the tell me about yourself question demands of you. So you can start with where you grew up, your family background. When did you find your love of science? When was your first exposure to the field of medicine or dentistry? But you want to be consistent with your personal statement and application narrative, but of course, not repeat it.
Also, this response should be incredibly distinct from your why medicine answer. They should be completely different and have very little overlap because they're just, you should think of it as two different opportunities to show who you are and show sides of yourself.
Yeah, and I think for most applicants, I think childhood experiences have a great influence on who you become as an adult. So I always strongly encourage students not to start from, that they're a recent graduate of Hunter College with a major in biology or biochemistry or psychology. Start from your early years. You know, what influences really made you who you are? And so talk about where you were born, who raised you, if you are an only child or you have brothers and sisters, how you spent your childhood, how your family and community shaped you, what values you were raised with, and how did these values inform your interests and activities? When did you discover your love of science, and when was your first exposure to the field of medicine or dentistry? And what was a life event or events that perhaps solidified your decision to become a physician or dentist? Again, in terms of length, I don't expect that you should speak longer than 2 minutes on this prompt. It's Francesca said, and I really agree, you don't want to go into any one experience in too much depth. They will always follow up if they want to. So for instance, if part of your tell me about yourself response talks about maybe your interest in like teaching or tutoring, you don't want to go into any great depth in terms of, well, my most meaningful teaching experiences was when I worked with students in my own community, and you go into great detail about a particular experience. That they can always follow up on. They can always say, I see you've done a lot of teaching and tutoring. Why don't you tell me more about your experiences in that regard, right? So, touch upon the various interests you have, but you shouldn't really go into any too great of a detail in the tell me about yourself. And as I mentioned before, I would start earlier. Don't start, by restating your name and your major at Hunter College. I do think it's helpful if you open with just thanking the interviewer for the opportunity to be there and tell them more about you. So, for instance, I think one of the hardest parts for students in preparing this tell me about yourself response is, well, how do I open? Do I just say my name again? Do I say my age? Do I say, when I graduated or my major? How do I open? And I think the easiest way to open the response is just by saying, like, first, I just want to really thank you for the chance to be here today and interview with you and tell you a little bit more about me. And then you go into, I grew up in wherever it is. I was from, a large family. A lot of you may have grown up in another country, come here later. Um, some may be born and bred here in New York. Some may have come from other parts of the country, but wherever it is, I think it's always nice to open with thanking the interviewer for the chance to be there. And as I mentioned before, while your interviewers truly want to hear all about you, just remember that this is a medical or dental school interview. So you want to demonstrate how all of these sort of life experiences that make you who you are connect to medicine and dentistry and your desire to become a physician or dentist, okay? This doesn't mean that every experience you talk about has to relate to medicine or dentistry. And as Francesca said, they will separately ask you why medicine or why dentistry. But, you know, after you briefly talk about your background, your experiences, what your interests are, and, you know, how you develop these interests, you want to just kind of connect it to, you know, what brought you here today, um, you know, in front of this medical school, um, you know, interview session. So, your experiences, hobbies, and passions have to show rather than simply tell why you are in the right place and why you are dedicated to becoming a physician or a dentist. I think personal anecdotes are really always important to include. Just make sure that the main message of your answer contributes to the larger picture of why you want to be accepted into medical or dental school. You know, instead of stating where you were born and just repeating that you've always wanted to be a doctor or dentist since you were a child, tell a story from your childhood that shows the life experiences you have had that led you to consider a career in medicine or dentistry. That doesn't mean that that's the same response as why medicine or dentistry, because obviously you've had further exposure and experiences that may have strengthened or solidified that. But when you're talking about what initially led you to think about this kind of career, you can, you know, talk about your personal stories. Um, yeah, you want to try to personalize your professional and academic experiences and kind of show how one experience has led you to pursue something else. And through all of this, you want to reveal your personality and your life with your answer. So like here is an example. You know, a student responding to a tell me about yourself prompt said, you know, I'm from Detroit, Michigan, and I wanted to be a doctor since I was little. But again, it doesn't really show why, okay? And it's just a statement of fact. Another way of saying this would be, I'm from Detroit, Michigan. Unfortunately, over the years, my hometown has undergone much economic decline, which resulted in an inability to access medical and dental care for the most vulnerable communities. And from, you know, early childhood, I witnessed the real difference that healthcare providers make for such communities. And their sacrifices and kindness influenced my choice to volunteer in a community health center for low-income families. And I've been doing it since I was 14. So this little bit of information provides a glimpse into where you come from. Also gives sort of an opening to who you are, the kinds of things you value, and it leads to the next, you know, part of your life and what you're going to talk about. But your conclusion really has to tie it together. And hopefully it'll satisfy their curiosity as well as generate further questions and leave a lasting impression on the committee. They can always dig deeper into certain things you mention by further questioning. Final points about the tell me about yourself. You just want to feel confident that your response allows you to establish this rapport and likability with the interviewer. And I think that's goes back to the point that Francesca really emphasized, which is don't memorize a response that you're going to give time over time at every medical school interview or dental school interview. You really just kind of want to understand the various points you want to cover and then just practice more generally, you know, by speaking to friends, colleagues, family. You become comfortable with talking about yourself. And so this way, you know, after you've practiced enough, you'll also feel confident to not only deliver your response naturally, but be able to adapt that response to different interview situations.
Just one more point there.
Sure.
When I was practicing, especially for my first traditional interview, I printed out my entire application. Well, I already had it printed out because you guys will learn that you need to print it out to go over it. But anyway, And I gave it to a postdoc in my lab, and she just went through it and asked me questions that interested her about me. And so that was a really great way to practice, because that's what's going to happen for especially the open file interviews. So I suggest doing that. And I also suggest not doing it with someone in your family, because it kind of can get a little weird and you kind of get a little uncomfortable, or you're too comfortable with practicing someone that you know and that knows you well. So I would practice with someone maybe, and then you also guys provide mock interviews. But yeah, I recommend doing that, and also taking a video of yourself, because especially that's how you will be perceived on the other end. And those ways really helped me.
Yeah, I second everything Francesca says. Um, okay, so after the tell me about yourself and probably the why medicine and why dentistry question, they're going to ask why our school. And I think that is another really, really important question for you to give a strong response to. So you want to know everything you can about this program where you're interviewing, as if you were prepping for a super important exam. Okay, so don't just read generally about the school. Read their blog, know their current events, know about research that's taking place there. Talk to alums or current students if you're able to access them. You can always reach out to the pre-health office for contacts. We can connect you with students who've interviewed at those programs in years prior and may in fact be current students there, so they can tell you more about the program. But you really have to be as informed as possible. Mission, curriculum, patient population, student population, demographics, affiliations, clerkships, research labs, matching, student-run clinics, elective opportunities, community interaction, student support services. Make it your job to know everything you can. The more school-specific homework you do, the more you'll be able to give a really strong response. And of course, you want to connect all of this information that you're gathering to your own goals and interests, okay? To, really show that this program has such strong connections to what you want for your medical school education or your dental school education, that you're a good fit for that program. Is there more you want to add there, Francesca?
I just hone in on the last point. I honestly don't even know if there should be any mention. I think the main thing is, how does your application connect to what you want to do at the school, what you can provide the school with? And every point that you make on what the school has, it should connect back to your application and what you've already done. And I think I always aim for two to three, 3 to 4 points. And I think that they should really be broad. So I always like to do, one research reason, one clinical reason, one academic reason, and then one extracurricular thing about the school. That's the backbone. If you know more, then obviously that's better. But then I think that having that backbone shows that, one, you have researched the school in all its parts, in all its entirety, and know how you will excel there. And it just gives a more well-rounded answer, besides just focusing on, one field like research.
Let's talk about other questions that you might be faced with. One, what is the greatest challenge facing our healthcare system? And of course, there's no one single correct answer, but you should be knowledgeable and, up to speed with 3 or 4 significant issues. So you want to be, familiar with things like access to primary care, dental care, health equity, cost containment, social determinants of health, adequate provision of mental health services, managing inefficiencies in care. I mean, we all know that these are common challenges facing our healthcare system. There may be others, but you want to be able to talk about several points that you can discuss intelligently. Whoops, let me just see here. Do you understand the current and future state of medicine or dentistry? So it's important to have a working knowledge of our healthcare system and its flaws. Understand how the pandemic impacted the healthcare landscape, what you learned from that experience. Understand conceptually universal healthcare and its benefits and limitations. Have an understanding of current political issues that impact the state of medicine or dentistry. There's quite a lot going on now. Be up to speed on hot topics in medicine. Be informed on physician-assisted dying or end-of-life options, AI's impact on healthcare delivery and medicine in general, doctor-prescribed birth control to minors, legislation that limits or prohibits abortion and its impact on medical providers, advances in cancer treatments, advances in treatments for HIV, or recent healthcare legislation, political impact on medical care or research. What did you use, Francesca, to make sure that you were well-versed on many different issues?
The AMC, AMA, American Medical Ethics, I think has a whole list of things that you can read on different issues. I used that. I used podcast a lot, especially like I really used a lot of podcasts. I think those were my main two sources. If I wanted to read more about a specific topic that I really needed, that I didn't understand or needed more opinions, I would just Google it and make sure you're getting a reliable source. But I think the AMA is really, really good because when you do give an answer to a question like this, you can reference the AMA, and that just makes you look more reputable. So I think those are
So
a
if there
resource.
are any specific podcasts that you can recommend, I'm sure if you want to put them in the chat,
I
uh,
can put them in the chat. I will do that now.
that's great. All right, just let's talk about the dental school interview. There are hot topics in dentistry too. Every month we publish or we post on our listserv the New York State Academic Dental Center newsletter, the NYSADC newsletter. Read it. Know what's going on in terms of research or events at each of the dental schools in New York. Know how AI is driving the digital transformation in dentistry and, much more, leading to much more accurate diagnoses and treatments. Know what's new in dentistry, the use of lasers for more procedures, personalized dental care, the rising connection between dental health and overall health. Know about the greatest challenges dentists face in managing a dental practice. Know about corporate dentistry and the benefits and disadvantages. Yeah, major healthcare issues. Be able to explain like a few sides of the issue. It's not simply talking about your view on it, but understanding the issue as a whole. Being able to understand a few different sides of the issue, some of the ethical tensions that are relevant. Obviously, you can have your own position, but it should be rooted in, a well thought out response. And of course, the best way to start your answer is perhaps with a story from your lived experience. If you volunteered at a food pantry, you can talk about food insecurity and its impact on health. If you did research on obesity or smoking, you can talk about that experience and the impact of those conditions on healthcare expenditures. If you're not a reader, become one now. Read articles about current issues in healthcare and dentistry. Read about current national and global news and understand what's happening in this country and around the world. And podcasts, right? Francesca mentioned podcasts. So she's going to just post a couple that she enjoyed listening to. I'm sure there are others. So even in traditional interviews, you can be presented with ethical questions. Okay, so you want to be aware of the 4 pillars of medical and dental ethics: patient autonomy, beneficence, non-maleficence, and justice. Just to give a quick review of these 4 main principles of medical and dental ethics. When we refer to patient autonomy, we are referring to the fact that the patient has the ultimate decision-making responsibility for their treatment. That you, as a physician or dentist, can recommend a treatment, but you can't impose it unless the patient is deemed legally unable to make an autonomous decision. So unless they're unconscious or unable to make a decision for themselves, you cannot impose any treatment on them. They have to exhibit what's called, or provide what's called, informed consent, meaning they understand everything they need to about the what is being proposed, and they agree to it. Okay, and they have the right not to agree to it. Beneficence, that requires that you must act in the best interests of the patient at all times. Your actions must be with the intent of doing good. So what does that mean? It demands that as a healthcare provider, you have to develop and maintain skills and knowledge, continually update your training, consider individual circumstances of all patients, and strive for net benefit. Converse of beneficence is non-maleficence, meaning that as a medical or dental provider, you are bound ethically not to allow harm to be caused to a patient either through action or inaction, right? Neglect. We know all about medical malpractice, right? And medical malpractice relates to legal ramifications from the not upholding this ethical principle of beneficence, of acting with non-maleficence. So consider, what are your risks with intervention or non-intervention? Do you possess the required skills and knowledge to perform what you're being asked to do? Is the patient being treated with dignity and respect? Is the patient placed at a higher risk through other factors, such as, lack of staffing or other resources? The concept of justice relates not only to laws that may impact the provision of medical or dental care, but also whether actions themselves are equitable, right? The idea of, delivery of resources on an equitable basis. And specifically, when there is an issue of scarce resources, how do we prioritize one group over another, right? And can this prioritization even be justified in terms of net benefit to society or moral convention? Questions like, you discover that your roommate in medical or dental school is cheating. What do you do? And this is, a common question, because they want to see that you're someone who has empathy and compassion, right, for your roommate. They want to see that you're able to communicate with your roommate in a way that shows respect for them and dignity. But at the same time, you want to be concerned for the overall impact of cheating, not only on the individual who is cheating, but also on the concern for the overall medical or dental school community. So you have to be able to communicate and discuss all of these various factors. In terms of dental school interviews, these are areas that might be covered in interview questions, things relating to breaches of confidentiality, failure to disclose dental mistakes, overall treatment and poor quality of dental treatment, request for fraudulent documentation, request for narcotic medications, request for inappropriate treatment, deceptive dental marketing and advertisements, impaired or dishonest colleagues, right? Like what happens if, your the dentist who shares your dental space is, he comes in every morning with alcohol in his breath. How do you manage that? Challenges with capacity and informed consent, conflict or unethical behavior among clinicians, challenges arising from management or finance or legal issues. So you just want to be able to intelligently discuss these things. This is an excellent ethics in dentistry resource. Talks about various issues in dentistry, ethical issues in dentistry. And we will post this presentation on our YouTube channel if you want to access that. But then there are the unusual questions, and I'm sure like Francesca can talk about that. You have all of your basic questions, and then there's always that like curveball question that really kind of throws you off, and you're not sure because you really haven't prepared for it. But questions like your 5-year-old nephew asks you, why is the sky blue? How would you answer him using a series of simple scientific experiments? Or how would you answer him in a way that a 5-year-old could understand? And this is really kind of going to your ability to make something that's really fairly complicated, understandable to someone who doesn't possess that level of knowledge. Any curveball questions, any unusual questions, Francesca?
Honestly, no. It was only if I mentioned something briefly in philosophy, they would ask me to explain it more in depth. And that was kind of nerve-wracking a little bit because I hadn't taken that philosophy class in a while. So only that, and just explaining my research to someone who's not in science, because I haven't done that before, and it's very difficult to do that, I think. And it's like, but only those two really.
Okay. So additional common questions that you want to be prepared to answer. A lot of these are, pretty straightforward. Why do you want to be a doctor or a dentist? Why do you want to attend this medical school, dental school? What's your greatest accomplishment to date? What's your most meaningful clinical experience? Describe a challenge you've overcome. How will your experiences contribute to the diversity of our school? What interest do you have in research? What is the toughest feedback you've ever received and how did you react to it? And other questions. What is your greatest strength? What is your greatest weakness? What do you like to do for fun? What's the last book you read for pleasure? Why should we choose you over other candidates? Did you ever get that question, Francesca?
I did. When I looked over the slide, I have gotten every single one of these questions. And not all, obviously not all in the same interview, but I have gotten every single one of these questions.
And when you were asking, when asked why should we choose you over other candidates, how did you frame your response?
I framed it with a story because the lab that I work in now, I was first a volunteer, and to get the volunteer position, I was up against several other candidates, and I was the only one that was a philosophy major. And had to be honest that I didn't really know molecular biology knowledge. And in a later conversation with my PI, he had told me that it wasn't, even though I really lacked the knowledge and the experience, I was the only one that was genuinely excited to be in the lab and to be interviewing and to be talking with them. And I connected that to say, being a person in medical school is much more than your stats and what's on paper. It's how you interact with everyone, how you approach opportunities. And I took it in that direction. So I
That-
used a story.
Excellent, excellent. More common questions. Tell me about a time you encountered a stressful situation at school or work. How did you overcome it? What do you believe will be your most significant challenge as a medical or dental student? And what do you believe will be your most significant challenge as a practicing physician or dentist? Okay, so think about those questions. Tell me about a time when you demonstrated leadership and describe your leadership style. Tell me about a time when you failed. How did you handle this situation? Tell me about a time when you had a conflict with a peer or supervisor. How did you resolve it? Tell me about a time when you made a mistake and how you overcame it. Some other unusual questions. Teach me something that most people don't know how to do. Okay, that was one I know was asked about last cycle. And also another one was, if you had to teach an elective course at our program, what would it be and why? Nicole, you have a hand raised.
Hi there. I just want to say thank you for giving this talk, Francesca. If you could share a question that you found the hardest and a sample answer that you gave, or any question that's maybe not on here that just found you in the spot.
I will think about that. I do have a question in mind, and I remember I texted it to my mother. So I will find that text. I will drop my email in the chat, and if you email me, I will email it to you. I remember what it was.
Okay, great. Thank you.
I mean, sometimes in dental school interviews or even in medical school interviews, I've heard of like the interviewer, just starting, oh my God, like I've had a really rough day. Just tell me a joke. Okay. And that can be really, that can throw you off. Like if you're not someone who typically tells jokes, I'm not certainly not somebody who does that. I'm usually on the receiving end. I like to laugh and I like to hear jokes. But if they ask you to tell something, just have something, in your repertoire to show you can um, you know, create a little levity in the interview. And also, it's also a way, there's a lot of providers use jokes as a way to help the patient relax if they are anxious. But of course, if you do, have a joke prepared, make sure it's appropriate for this kind of setting. And for those who are going to be interviewing at osteopathic medical schools, know that you're going to be asked about osteopathic medicine. You're going to have to explain why you're choosing to be an osteopath over an MD or other healthcare professional. You're going to be asked what you know about osteopathic medicine. So you have to be prepared to discuss the main tenets of osteopathic medicine and OMM and what you have learned about it. And if you're just applying to a few DO schools and your primary focus is going to be MD schools, you still have to read up on osteopathic medicine. If you go for the interviews, you have to give your best performance, and you should know anyway about the program and what distinguishes osteopathic medicine, the history, how it's changed, how today many osteopathic techniques are similar to certain allopathic paths as well. So, we know now that DOs and MDs work alongside each other in all specialties, and we know now that DOs and MDs match for the same residencies, but they are going to ask you what you know about osteopathic medicine. And another question too, they're going to ask about other medical schools you've applied to, and if you applied to any MD programs. And I think, it's important to specify, that you did apply broadly, because you know how competitive medical school is, and you chose programs that really align with your goals for medical education. But be prepared to discuss how DO medicine is one of the fastest growing professional careers in the US, and know that MDs and DOs are matched together for residency. But you should read up on osteopathic medicine. And here are other sites on the Princeton Review and the Savvy Pre-Med with sample interview questions. We also recommend purchasing a copy of Dr. Ryan Gray's The Pre-Med Playbook Guide to the Medical School Interview. Did you specifically use any particular resources, Francesca?
I use Savvy Pre-Med, I use Princeton Review, I use Student Doctor Network, and then I also use the traditional medical school interview book. That's also that the authors also have the MMI
Oh,
interview book.
the Dr. Desai's book?
Yeah, I use that as well for the traditional medical interview. So I had both of those books, which were great.
Oh, so you mean Dr. Desai wrote another book for the traditional?
Yes.
Got it. Okay, good to know. Here is a helpful site for dental school interview questions. For under roadmap prep. But again, we're gonna, I'll post this Zoom recording with the slides on our YouTube channel so everyone can access this. Practice, practice, practice. As Francesca said, you want to look up questions. Student Doctor Network is a very good source for specific questions that those programs tend to ask, and you want to practice your responses, record your responses, review your recording. As Francesca says, you also want to video yourself, so you want to see how you come across on camera. Practice the tell me about yourself and the why medicine dentistry questions. Make sure they do not sound scripted. All right, at the end of every interview, you have to know that they're going to say, do you have any questions for us? And I think that's going to be typical unless you run like way over time for the interviewer. And I think Francesca can expand a little bit about that. But you have to be prepared to ask a question or two. Is that correct?
Yes, I always prepared questions specific to alumni, questions specific to faculty, and questions specific to a medical student, because oftentimes you don't know who is interviewing you, and you don't want to have a set of questions that are, only a medical student can ask, and then you don't have any questions to ask. So I would prepare a wide range of questions. And I always asked if it was okay if I could ask my questions if they don't mention it. And I also, even when the interview is over, I always ended it by saying, like, thank you so much. Is there anything else that I could expand upon or clarify? And that sometimes they will say, actually, yes, and ask one more question. Most times they won't, but I think it's good to show you're in tune. But yeah, I would prepare wide-ranging questions.
So some questions, that you could ask your interviewer, like, what's your best advice for a first-year medical or dental student? How did you become affiliated with this medical or dental school? And what do you value most about this institution? Do you have any planned changes to the curriculum? If so, when and what is the goal? And of course, you don't want to ask anything that's, obvious from the website or obvious from what was discussed at the information session. So, even though you may have certain questions in mind, you may have to adjust those questions depending on what has already been discussed. Thank you notes. It is critical that you follow up with thank you notes, emails, not handwritten, emails to your interviewers and even the individual who planned the interview day. If you were in communication with someone specifically who planned, and orchestrated the whole interview day, you can send them a thank you note as well. And they should be sent out within 12 hours following your interview. I recommend sending an email thank you note so you know it's promptly delivered and read. Please read the school's protocol regarding communication. Some schools prefer the emails are sent through a specific portal. You can usually find the email addresses of the people you interviewed with on the school's website. But if you have difficulty finding them, you can always contact the person who arranged the interview day and ask them for the email address of the individual who interviewed you. Any additional pointers on thank you notes?
I would always ask how, if they don't specify, I would always ask, because more times than not, they want the thank you note to go through the admissions office. I think in part to not bother the interviewers, but also in part to know that you did send a thank you note, excuse me. So I would always ask, because it's more often than not gonna go through the
And who did you ask?
I usually ask during at the end of the interview day, the person heading up the Zoom, who is usually a member of the admissions office.
Okay. But I would keep your note brief and to the point. If there are special topics or information that you discussed with your interviewer, you can mention that you enjoyed talking about those things or learning more about whatever you specifically discussed. This is, I know I'm kind of running over time, but this is, a sample thank you note that, you can look at when you access the recording. Things not to do. Okay, obviously don't be rude to staff or students, don't dress inappropriately, don't sit with your arms crossed, don't be late. And I mean for virtual interviews as well. Make sure you log in and you're ready to go well in before the interviewer. Don't wear giant headphones. Don't be negative or sarcastic. Certainly don't swear during the interview. Don't forget to silence or turn off your phone. And when I talk about swearing, even if you're interviewing with a student, you want to keep your language professional. Don't chew gum during the interview. Don't sound too rehearsed. Don't ramble or go off topic. Don't offer bland or generic answers. Don't lie about your skills or your experiences. Don't gossip about other medical schools or other applicants. Don't list your impressive qualities without also providing evidence from your past. Don't exhibit nervous habits. Don't ask simple questions that can be answered on the school's website. And don't forget to send a thank you email after the interview. Any comments on this, Francesca, from your experiences?
Just to hone in on the don't swear during the interview, I thought this was obvious, but I was in an interview and the admissions person said, make sure to not swear or talk unprofessionally during your interview with a medical student. They're still a part of the admissions process. So that actually does happen. So just, yeah, note that, I guess. And, especially read the directions, because certain interview days will have their own specific protocols. For I know for one school they wanted us to join 20 minutes early because they wanted to, I don't know, they wanted to do something. So that, and then there's sometimes things to do after the interview. So just make sure you understand what you're responsible for the entire interview day before and after.
Excellent advice. Okay, so over time, I think you're going to develop a confident mindset, and that's going to be really important. Much of the fear and anxiety that students experience during an interview comes from the unknown, like not knowing what questions will be asked, not knowing if you will perform well. But we know that practice and repetition can help normalize stressful experiences like this. You can also consider incorporating a daily meditation or mindfulness practice to build your confidence and understanding and uncovering the depths of your thoughts and motivations. Okay? And I'm sure as you also, the more interviews you had, Francesca, the more you felt comfortable in that environment.
Yeah, definitely. It got easier as it went along. And also just remember, if you are stumped on a question, or if you are nervous or you notice yourself going too fast, what I would always do is say, oh, could I just have a minute to think about that, please? Or something like that. And it's always well received and it can make the difference in your response. So that's always a good tool to have.
So students who are receiving committee letters, we will do our best to provide you with a mock interview session. Multiple mocks are going to be very difficult, so definitely look to other people that you are either working with or performing research with, or other friends who are medical school students or dental school students, and try to come up with a group that you can practice your interview skills with. It's also helpful because each person will, provide a different style of interview. And I think that's going to be helpful too. But I really want to thank Francesca. You've been terrific today in just helping really go through all of this. Your advice has been terrific. Uh, I assume there might be some here who need me to share the link to the reflection statement. So I'm going to try to pull that up now and post that for you. Bear with me. Other questions for Francesca while I look for this? Go ahead. No questions?
I have a question. I couldn't find the raise hand function though. My name is
Uh,
Alona.
oh, okay. Hi, Alona.
Yeah, so I have a question for Francesca about so I'm applying to medical schools, both MD and DO, and one of the ones I want to apply to is Albert Einstein. However, I know that now with the free tuition, it's going to be definitely even more competitive, and probably one of their main questions would be like, why our school? Maybe they're trying to like weed out if you just want to go to school for free tuition. But how do we because I've been interested in that school even before the free tuition, how do we just like show that through our interview answers while also being honest that, free tuition is a plus?
I wouldn't mention the free tuition because I think it's kind of obvious and it's obvious. You don't need to mention something that's obvious. I think that to be genuine, you would just, like I said, do like a wide-ranging reasons that one reflect what you've already done, because then it does show a genuine interest. And then you also have to do your research and show like you know what you're talking about when you do speak about it and how it does connect to what you've done. And I think that goes for every school, not just Albert Einstein. I think
Yeah.
that should always be there. And yeah, I just wouldn't mention the free tuition because I think that it's obvious, and I think it's poor taste to
Yeah.
talk about tuition. Because you wouldn't go to SUNY Downstate and say, oh, because of the in-state tuition. That's also something you wouldn't
Yeah,
say.
that's like that reason for sure. I just meant more like, I don't know if there would be interviewers who could ask, like, how there's surprise questions they could ask about the free tuition. I don't know. Is that a possibility?
I
Are you,
am
you're,
not
you're
sure.
saying, are you asking if they would say, do you want to come here just for the free tuition?
Yeah, I don't know. I've heard some crazy stories from other people, so I'm just asking. I want to make sure because that's a crazy question.
Well, I think if you're applying to that school and it is a school that you see yourself at, it shouldn't be because it's free. It should be because your goals for a medical school education align with the mission and values of the Einstein program. And I think that's what you have to focus on. And that should be easy to draw upon from just talking about your experiences and what you care about and what motivates you and the kind of physician you hope to become. And I think if you focus on that and not make it about the free tuition, I think that's what they're looking for. Because
Yeah.
I've spoken to the dean of Einstein, and this is after it became free, and they said they're not wavering on, what the kind of applicant that they want to see. And that's one that aligns with their mission and values.
Okay. Yeah, I'm just asking because I've had an interest in this school before they became free tuition because I like that they're really aligned with the research aspect and the
Well, then
underserved.
that's what you have to focus on,
Yeah.
Alana.
Okay. Thank you so much. Because I've been hearing horror stories from other students. I don't know how true they are, but yeah, just a lot of crazy stuff after they went free tuition. I don't know if it's true, but thank you so much.
Other questions? This is your opportunity. Francesca is here. I did post the link to the PAP 1003 reflection assignment. You will see it in the chat. Please don't wait. Just fill it out and submit it. Francesca was also kind enough to include her personal email, so you can take that down and try to, you know, she will answer you if you email her. She's excellent. And thank you for posting the podcast that you listened to. That was also excellent. Great. I really, really appreciate it.
Thank you.
Let's see.
Hey guys, I had a quick question. I don't know if you guys can hear me.
Hi, Anna.
Hi, I'm hello again, Francesca. I wanted to ask, how common is it to get questions? And I'm sorry if there's things but how common is it to get a kind of aggressive interviewer that wants to know how you function under stress or under aggressive interview style? If that's common, or if you ever come across that in your interviewing stage.
I had one interviewer like that, and I don't know if it was to test me or if that was just his demeanor. And you just have to do it with grace. You have to not go too deep in the answers unless it calls for it, and to just remain positive. And I'm a very positive, upbeat person. I didn't change that depending on how he was answering. And just because it goes like that doesn't necessarily reflect. You have to remember throughout the interview that they are not a reflection of you or how you're doing. And it ends up fine. I got into that school, and afterwards I thought it was a horrible interview because he didn't seem to like me, but it could have just been him testing if I was stressed, under stress, or just that was how he is. So
Have you had interviewers that basically did not emote, had the poker face, and no matter what you said, they didn't seem to be responsive or interested?
yeah, that was him. He just seemed so uninterested in the conversation, and he just wanted to get it done with. And the interview lasted, I think, 25 to 30 minutes when it was supposed to be an hour. He just really didn't. It seemed so horrible, but it clearly couldn't have been because I was accepted. So you can't get down on yourself even within the interview, because I even felt myself getting nervous after the second question that he wasn't really picking up his vibes, for lack of better phrasing. And I knew that that was a possibility because I have attended this PPAP and I've talked to people, and you kind of just have to persevere. And then there's also those other interviewers that will kind of hammer in on what you're saying and just keep asking a follow-up question, a follow-up question, a follow-up question to see if you know what you're talking about and how you react. And you also, that's in the same sense, you cannot get overwhelmed or you can't react back. You just have to kind of keep your same composure.
All
Awesome,
good
thank you so
advice.
much.
Nicole?
I guess on that same topic, I know like there's no really one version of a successful interview because obviously that interview went well. But what does a successful interview to you feel like at the end, or what did it look like?
It feels like I was able to really demonstrate all. Actually, you know what? I'm my biggest critic. I always felt like I could do better. You always feel like you can do better. You always feel like you could have said something else or said something better. But I mean, then you kind of rationalize with yourself, okay, I was able to talk about X experience and how it connects to X part of mission. I was able to, I didn't stutter. I was able to look professional. I communicated my values. So I mean, it could always go better. There's like those, they're really not supposed to give you feedback during the interview. I've heard that before, but there's been some cases where an interview would end would say, "Oh, I hope we see you in the fall," or, oh, it's been my pleasure interviewing you. And those are usually good signs. I haven't had any. I've only had the good signs, not the bad signs, if that makes sense. So I can't fully answer your question because I don't have a sign of, oh, that interview went bad, because that hasn't happened.
So I'm gonna let a couple more questions and then I really do have to end the session. Benjamin?
Hi, can you hear me? So I wanted to ask, Francesca, did you take the interview or do the interview during COVID? Like you're a
No,
medical.
I'm a current applicant. Yeah, I applied in the last cycle, so I just finished interview. No, I didn't.
Oh, okay. Because I was gonna ask whether you had any, extra tips based on how you've seen the current interview cycle kind of change and adapt after COVID and just like in general, like any changes like
Well,
that we
I
could.
think you have to be aware of the changes in healthcare as a result of COVID, as a result of the pandemic. And there have been a lot of changes. I mean, even though the pandemic is, we're 5 years out, there's still, reverberations throughout healthcare in terms of telehealth, in terms of, other, there's still a COVID question on the applications. You still have to be able to articulate, are you someone who understands what it means to be on the front lines of healthcare if there were another public health emergency like COVID? So, you might get questions like that, but luckily, we're sort of out of the darkest part of
Yeah,
the right now. All
I
right,
was
thank
just
you so much. I really appreciate it, and I'm going to wrap it up. Again, I would this seminar as well as the slides, the recording and the slides will be posted on our YouTube channel. It was my pleasure to be here today. Thank you again to Francesca. Have a good day, everyone. So long.
Best of luck.